Welcome back and thank you for staying with the Hot 7 Nightly News. Journalist and newspaper publisher Rick Wayne is defending the article he wrote that in effect announced the resignation of Dr. Euwaldus Raymond. The story quickly became media fodder and was cited by some media houses who announced the resignation as fact. The Prime Minister a few days later would describe the reports as inaccurate. So, did the media get it wrong? Not the Star. That's according to its publisher. He was a guest on Hot 7 TV's Hot Seat with Trisha Lionel on Saturday.
It is better to get it right than to get it first. It's a journalism maxim that many reference when it comes to the art of breaking a news story. Joe Public, particularly on social media, has taken the media fraternity to task for the reports about the resignation of Dr. Euwaldus Raymond. The Prime Minister later refuted those reports. The man who takes credit for breaking the news story, Star newspaper publisher and award-winning journalist Rick Wayne, says his credibility has not been affected. Wayne's The Star article read, quote, "According to good authority, Prime Minister Alan Shastney has accepted Dr. Euwaldus Raymond's resignation, both from the St. Lucia Senate and as a government minister in charge of the public service effective next week. Dr. Raymond is currently off island on official business and was unavailable for comment." End quote. Wayne is adamant that not only did he get the story first, but he also got it right. He was a guest on Hot 7 TV's new program Hot Seat with Trisha Lionel on Saturday.
Somebody can say something to you at this very moment and be correct and truthful in every respect. Then by Saturday, where you don't have access to them or you can do nothing about it, something has changed in the equation. Not that the guy lied in the first place, but the people he reported on have taken a different step. So it does, I'm not saying that's the case in the Euwaldus. I'm saying this thing that if a guy said this on Monday and things turn out to be different on Thursday, then the guy lied. It's short-sighted and stupid. Because the guy may have spoken nothing but the truth on Monday, but by Thursday, the whole thing has changed, so there's a new truth now waiting to be written about.
Wayne argues that the Star article itself was not rebuffed by the Prime Minister. Alan Shastney, when facing the local media scrum ahead of the throne speech, said news reports that Dr. Raymond resigned were inaccurate.
Are the reports wrong? That was the question. And he said correct, meaning, yeah, the reports are wrong. And it never occurred to anybody to ask, what report did you read that was wrong? What report did you read that was wrong? Then they would have known. They would have known, in fact, he was referring to one report that he heard, which is all he heard since he wasn't in town anyway. And if a little more prodding, they would have been more specific and asked, for example, what did you think of the Star report? And he would have said something, and you could have said he referred to the Star. As it turns out, he was not referring to the Star because he had not seen the Star story. He still had not seen, even yesterday, the Star story. He saw a report on television.
The newspaper publisher has no intention of revealing his source, but makes it clear that his source was credible and that he, as a seasoned journalist, went through a process of verification of the information before running the story. So what happened?
I remain a journalist with my own stories too.
Right.
I'm not going to blow my stories here. I'm trying to point out that to quickly run up and say a source lied, we're quick to call people liars. I am pointing out to you a source, a reliable source that you trust, and tell you something and you can validate it because even though I check, what sources do for me is alert me and then I validate before I write. So Monday's truth may not be Wednesday's truth because things can change, especially with politicians.
The Attorney General's office announced on Thursday afternoon, almost a week after the resignation story, that Dr. Raymond is on leave while an investigation takes place. The release indicated that following an initial probe of the matter, more information has come to light which warrants further investigations by relevant authorities.
The Department of Health and Wellness is continuing on in its efforts to manage the present situation of an increase in influenza cases on island by sensitizing public and private healthcare workers. We hear more in this report from Fernell Neptune.
Healthcare professionals around the island were granted the opportunity to strengthen their capacity on ways to effectively control the spread of influenza for a sensitization workshop held recently. Medical Officer of Health Dr. Sharon Belmajod says the Department of Health and Wellness is dedicated to ensuring proper management of influenza when St. Lucians visit both public and private health facilities.
One component of our strategy is to ensure that all of our healthcare workers, both within the public and the private sector, have been given some updated training on influenza and the new strains that are circulating. This we are doing to ensure early diagnosis of especially the complicated cases of influenza, to ensure that all of our levels of healthcare workers are able to diagnose early and to treat effectively, and also to know when to refer to our hospitals for our complicated cases. We are also encouraging them to ensure that all of their patients with chronic diseases or with risk factors receive the influenza vaccine that we have available free of charge at all of our wellness centers.
Dr. Belmajod says it is important that St. Lucians take the necessary precautionary measures as to prevent the spread of influenza.
We also continue to educate them on the sanitary measures such as regular hand washing and cleaning of surfaces. And if someone has the flu, we advise them to stay home and not go into public places where there are other persons to increase the possibility of spread. We also ask persons to ensure if they're coughing that they don't cough out where other persons are present, that you cough into a tissue or you cough into your elbow if need be as well. And we are asking persons that if they notice they're not getting well, they're not getting better after having a bout of the flu, that they visit their healthcare provider, be it in the public sector or in the private sector, that they ensure they get care. For persons with more severe forms of the flu, we have Tamiflu available at our healthcare institutions to reduce the severity of the symptoms of the flu as well and to shorten the time period.
The Department of Health and Wellness urges citizens to take advantage of the flu vaccine available at all wellness centers free of charge. Reporting from the Communications Unit of the Ministry of Health and Wellness, I am Fennel Neptune.
The rocky start to the school year placed the Ministry of Education under the microscope as many examined the less than ideal conditions at many schools. Minister for Education Dr. Gail Rigobert, in her contribution to the 2019-2020 Estimates of Revenue and Expenditure debate, dissected last year's allocation of EC $10 million for school refurbishment, whilst detailing this year's allocation. Solange Alfred tells us more.
The less than favorable conditions of many learning institutions on island have been brought forward as a point of argument by teachers, students, and parents. From outdated desks and benches to poor ventilation and termite-infested structures, the list seems to grow daily. At the 2019-2020 debate on the budget of estimates and expenditure, Minister for Education Dr. Gail Rigobert stated the 2018-2019 allocation of EC $10 million worked towards creating better learning institutions.
We had committed to injecting EC $10 million into the education sector exclusively for the rehabilitation of schools. Mr. Speaker, on behalf of principals, teachers, guardians, parents, and the students themselves, I wish to express my most profound gratitude to the Minister for Finance and to my colleagues, and to the team from the Ministry of Education responsible for implementing this $10 million school rehabilitation program. But more importantly, Mr. Speaker, you will observe that in this year's budget, under head 52, line 42 on page 405, there is a further allocation for national infrastructure maintenance, of which $10 million are earmarked for the summer school rehabilitation program to facilitate our continuing efforts to address some of the perennial infrastructural challenges that confront this sector, and to ensure that the children of this nation are housed in buildings conducive to learning and development, and that educators too can benefit from a healthy working environment.
During her presentation, Dr. Rigobert highlighted that a total of $1.465 million looks to be committed for remedial rehabilitation of Sir Arthur Lewis Community College. She would later go on to apply pressure to Parliamentary Representative for Vieux-Fort South and former Prime Minister Dr. Kenny Anthony, who alluded during his presentation that pressure from parents was the reason behind the rehabilitation work done at Beanfield Secondary School.
Thanks to a healthy collaboration, the dedication of stakeholders, and the commitment of this administration to the people of this country, we were able to simultaneously resolve the long-standing problem at the Vieux-Fort Primary School, which for years had been requesting resources to rehabilitate a long-abandoned derelict block on the school premises at the Vieux-Fort Primary School, and at the same time, while creating new classroom space to accommodate incoming students at the Beanfield Secondary School, which evidently had run out of space. It took this administration, Mr. Speaker, to resolve those two problems in Vieux-Fort South in under 3 years in office, notwithstanding the representation they had from a prime minister for more than 15 years.
Moreover, Dr. Rigobert noted that the 2019-2020 budget makes allocation for a plan dubbed the EQUIP project, described by Dr. Rigobert as a suite of projects combined to help transform the education sector. She also advised that the design phase for reconstruction of 3 primary schools is under review, namely Laguerre Primary, Vidboutet Primary, and the Gordon and Walcott Methodist Primary School. Reporting for Hot 7 News, I am Solange Alfred.
Healthcare facilities are expected to be safer, greener, and more resilient to natural disasters through the implementation of the Smart Healthcare in Caribbean project. More in this report.
The Department of Health and Wellness, in partnership with the Pan American Health Organization, PAHO, recently hosted a multi-stakeholder engagement on the Smart Healthcare Facilities in the Caribbean project, aimed at ensuring involvement in the changes at the facilities. Permanent Secretary in the Department of Health and Wellness, Felix Senthill, says he's very pleased that this project will seek to improve the delivery of services at primary healthcare facilities around the island.
In St. Lucia, we have chosen 15 out of our 34 wellness centers for retrofitting and effecting improved structural and operational safety with environmentally friendly interventions. It is expected that these interventions will not only improve the quality of air circulation and allow the staff of the respective institutions to work under more favorable conditions, but will also decrease the consumption of energy and water, thereby reducing our carbon footprints and ultimately increasing patient satisfaction.
PAHO and WHO representative for Barbados and the Eastern Caribbean, Dr. Godfrey Shreb, says the smart healthcare facilities go beyond safer, greener, and climate resilient.
When we talk about smart facilities, we talk about facilities that provide smart services. And what do I mean about smart services? Smart services are services that reflect the needs of the population of St. Lucia today. So smart services are ones that are developed through the profile of the health needs of the country.
The Smart Healthcare Facilities in the Caribbean project is currently implemented in 4 participating countries: Dominica, Grenada, St. Lucia, and St. Vincent and the Grenadines. The project is funded by the United Kingdom's Department for International Development. Reporting from the Communications Unit of the Ministry of Health and Wellness, I am Fennel Neptune.
You're watching the Hot 7 Nightly News. Stay with us. We'll be right back.